Hi, I'm really glad that Dr. Duffy-Sherr invited me to come speak with you this afternoon. And I wish that I could have been with you live and in person. Unfortunately, I had a prior commitment, but I wanted to record this video to share with you all. So my name is Dr. Kristen Vogel-Campbell. I have been in special education for about 20 years, give or take, probably more take. I started my career as a paraeducator, and I have been a non-public school teacher, a elementary special day class teacher, a middle school resource specialist, a program specialist. Most recently, I was the director of student services and special education for a school district in San Mateo County, and currently I am the coordinator of special education for San Mateo Foster City School District. So Dr. Duffy-Sherr asked me to come in today to speak with you from my perspective as a special education administrator. First, talking about interviewing for a speech-language pathologist position within a district, then more about the expectations of a SLP in a district-based setting. And so in terms of the interview, preparing for an interview, so knowing the district that you are interviewing for, it's always good to do some homework, to look at the website, to get an idea of the demographics and the grade levels of the schools that are in the district. If you know if you're interviewing for a particular school, getting an idea of what specialized programs they might offer. For example, if it's a STEM or a STEAM or an immersion school, having that and utilizing some of that in your answers shows the interview committee that you are invested in possibly joining their team. Then also, if you are interviewing over Zoom, making sure that obviously if you are sharing a workspace, making sure that you have a dedicated quiet space for the duration of the interview, making sure that all of your tech is ready, making sure that your sound is solid, and if not, utilizing headphones. And if you are coming in person, the professional, or what's considered professional dress code, has definitely changed over the past 15, 20 years or so. But I would err more on the side of business casual for an interview. A nice pair of slacks or dress pants and a shirt, or a blazer if you'd like. If you are interviewing for a school-based position or a preschool position, definitely wear comfortable shoes. I would say, dress a little bit more formal than you would on a typical school day. And the majority of schools at this point, if you are wearing a sweater and, nice jeans, that, during the workday, that should be okay. Questions that you may be asked during an interview. So I've been interviewing a lot of speech language pathologists over the past few weeks for this upcoming school year, and definitely wanting to know, why you're passionate about speech language pathology, like what brings you to this profession, especially over the past few years. Public education and special education in general has been really challenging. So, showing the interview panel why you're committed to a position in their school district, especially if you're brand new. They might ask you about your experience delivering particular assessments. So you will want to have the names of the assessments that you've done during your practicum or during any type of volunteer work handy. And also remember that some of the members of the interview panel may not be speech language pathologists. So I would say to, give the name of the test and then say, and this test measures receptive language, expressive language, pragmatics. And then I would also talk a little bit about how you communicate with colleagues, how you communicate with parents, and how you communicate with students. And of course, since if you are new to the profession, you can definitely utilize some of your past experience if you have volunteered in schools, or if you have, worked in another function in schools, how you would do these particular types of things. Then, there's always an opportunity for you to ask questions. So I would say, definitely ask about, case size and expectations there. Ask if it is a split position between school sites. A lot of districts will have an SLP share caseloads at 2 different elementary schools, for example. The district that I just worked in, we were really small, so we had depending on the size of the caseloads, we had an SLP who would go to 2 different schools. So asking like how that's generally split up. I would also ask what professional development looks like for SLPs, and what type of collaboration is possible between other speech language pathologists, the special education team in general, and then general education and special education. There's not really a wrong question to ask. I would say to definitely just, if you feel that it's an appropriate question, then if that's something that resonates with you, and you are not able to get that answer from the website, you can definitely ask. And I would say if you're able to get the names and emails of the folks on the panel, to follow up with an email afterwards, thanking them for the interview. If you only have the email address of the lead interviewer or even the program secretary that set up the interview, it's always a common courtesy to follow up with that nice thank you. You would be surprised how infrequently we actually get those thank yous, and it does mean a lot, especially if an interview panel is interviewing 3 or 4 candidates. If they get one thank you, that could raise your chances of getting the position. And with that, being optimistic, you've got the job, now what? And there are lots of expectations for district-based speech language pathologists. During onboarding or new employee orientation with the special ed department, they will probably go over a lot of this with you. But some of these are things that you will have to seek out either through the program specialist that's assigned to your school sites or your fellow SLP colleagues. So service logs, making sure that students receive the services that are outlined in their IEPs. And a lot of the special education databases that most districts use in Northern California, both SACE and CIRUS, have a service log tab so that you can track those service minutes, especially if you are in an IEP that is slightly contentious, where the parents or an advocate or an attorney ask to see service logs. Those are things that you can easily produce. Some districts do Medi-Cal billing, and this is a process where the district can receive some reimbursement of funds for services and assessments that particular service providers do. So this might be a question to ask within the first few weeks of the school year if your district does participate in it, and then asking to just get set up and just to get a general idea of how to do that. It is advised that if you are participating in Medi-Cal billing, to complete this on a weekly or a monthly basis. You don't want to wait until the end of the year, because then you're having to write down and note a year's worth of services. So I generally have advised my service providers to do this alongside the same time they do their service logs, either on a weekly or a monthly basis. Depending if you are at an elementary school site or a middle school site, you will be doing progress reports either 3 or 4 times during the year, including the annual IEP. So you will want to get an idea of when those dates are, and those usually align with report card dates. And then assessments. So wanting to get an idea of what the expectations are for initials as well as triennials. So again, initials are when we are first determining if a student is eligible for special education services. And then triennials is that every 3-year evaluation to determine continued eligibility. And some districts will do what's called a multidisciplinary report, which is just self-explanatory, multi-disciplines putting their assessment results together into one large report. So generally the school psychologist, if they're involved, is the point person for putting that report together, but you are generally sharing some observation and interview details so that the parent is speaking with one professional or a group of professionals at one time, as opposed to speaking to each individual person. So you'll want to know kind of what the best practices in that district. There's no right or wrong. Some districts prefer each service provider doing their own reports by their own, and then some prefer multidisciplinary, but it's good to know what the expectation is. And then once you get started, getting an understanding of what special education database or IEP system the district uses, getting an idea of which of your students you will be responsible to case manage, meaning the only service that they receive is speech, and then making sure that you are calendaring all of the due dates for your IEPs. So I know that Dr. Duffy-Sherr has gone over legal timelines with you, so that we need to meet at least annually for a review, and at least every 3 years for a reevaluation. So some school sites will meet at the beginning of the school year and tentatively calendar all of their annual and triennials. And as long as it works with the parent's schedule, those are the dates that are set in stone. Making sure that you give yourself enough time to get the assessment plan sent out and signed by parents to give you as much of that full 60-day window before the triennial IEP is due. And then finally, communicating with both colleagues and parents. So some districts are also pushing towards co-treatment. So a lot of districts will have occupational therapists and speech therapists providing therapy at the same time, depending if it is appropriate for the student, both developmentally, and if this is something that's relevant towards their IEP. Making sure that you are checking your email on a consistent basis. I think that at this point we are moving towards email primarily, but also realizing when it is just best to pick up the phone and make a phone call to parents. My rule of thumb is if your email is longer than 2 paragraphs, you're probably going to want to pick up the phone. Knowing who at your school site or in your department is able to translate if you have Spanish speaking parents, so that they are able to access and understand the information that you're presenting to them. And keeping a phone log, so getting a notebook and tracking the dates and times of the phone conversations you have with parents, and just a brief summary of what you discussed, because you won't necessarily remember a conversation 7 months from now because you've had 20, 25 IEPs. But we have to remember that for parents, a lot of times this is their only child with an IEP, so they're going to remember that conversation. So making sure that anything that you say or that you promise is noted, and so that we're able to follow up on it. And then finally, in terms of continued professional development and growth, this is where you will do some collaboration with your SLP colleagues, either accessing professional development in the district through mentorships, or learning from more experienced SLPs, or going to virtual or in-person conferences and trainings. I know that Cal OSHA offers a lot of fantastic resources that I'm sure Dr. Duffy-Sherr has already shared with you. She is the SLP expert, but you'll want to make sure that you're getting those continuing education units, not just for any type of salary schedule increase, but also for your continued growth as an educator and a speech-language pathologist. So just in closing, if you do have any other questions, please feel free to email me. My email is on the screen. And, hopefully this was a worthwhile and relevant chat, and looking forward to hearing about all the tremendous progress that you're making in Dr. Katy's class. So thank you very much.